Hello, this is KWillis, and today I'll be speaking with you about the AIDS crisis in Haiti. Now, just to give you an idea where Haiti is located, it's considered to be the poorest country in the Western Hemisphere, and it actually makes up about a third of the island of Hispaniola in the Caribbean, and the eastern two-thirds of that island are the Dominican Republic. To give you a little bit of background information about Haiti, it's roughly the geographic size of the state of Maryland, and its population is roughly about 10.5 million people, which is about half the size of Florida. It's considered to be a low-income country where the actual per capita gross domestic product is about $1,800 a year. And its unemployment is remarkably high, anywhere from 40 to 50%. It's considered to be somewhat of an unstable country. There's been a lot of political upheaval in recent decades, and the country's been prone to disasters such as earthquakes, cholera, and frequent hurricanes. And some other interesting facts are that are not shown here, actually, but the life expectancy in Haiti is roughly around 63 years old, and it's important to note that Haitians typically live on less than $2 per day, and about half of the country is considered to be illiterate, while 40% of Haitians do not have access to health care. Meanwhile, close to 60% of the country is actually living under the poverty line. Now, to give you a little insight into what's been going on with regard to HIV and AIDS within the particular region, being the Caribbean, the number of AIDS-related deaths has actually declined at a much higher rate than it has globally. There have been estimates that this decline has been roughly about 52% from the years 2001 to 2012. And just to correct myself, actually the incidents have gone down by roughly 49% during that time, while the number of AIDS-related deaths has actually decreased by a slightly higher percentage, roughly 52%, from 24,000 to 11,000. Now, the predominant mode of transmission in the Caribbean has primarily been through heterosexual sex. It didn't exactly start out that way, but a number of the countries in the region, they have features of both a generalized as well as a concentrated type of epidemic. And within the region, the epidemic mostly started out as concentrated through sex workers as well as men having sex with men, and they've kind of morphed into a more generalized epidemic in the region as well as within the country of Haiti. And I found some interesting statistics about Haiti's neighbor, the Dominican Republic, in that men having sex with men, they have they account for roughly about 1/3 of the new infections as recently as 5 years ago, and heterosexuals are about the same amount. Sex workers account for a very small percentage of new infections, and clients of sex workers actually account for about 5% of the new infections. And this is within the Dominican Republic. Now, even though HIV/AIDS has been around a long time, it's been known worldwide for roughly 3.5 decades now. There was a lot of controversy surrounding its origins, and especially with respect to Haiti's role in the initial outbreak. And some of the controversy surrounded how the disease came to the United States, and there was the CDC actually described four particular risk factors, and one of them was initially declared as being a person from Haiti. And so this created a lot of problems, especially for Haitians that were suddenly, the stigma was attached to them, and it really created a lot of problems for the Haitian tourism industry. A lot of people lost their jobs as a result, and a precarious situation in the country at least economically and politically, was only undermined further. And as far as the first cases in Haiti, it's believed that these came from individuals that had been living for a time in Africa, had contracted the illness, and returned to the country. I believe it was sometime in the 70s. It was a small number of people that had been infected, and apparently it spread throughout Haiti. At first, it was somewhat of a concentrated epidemic, but this was roughly around 1982. It spread significantly in the capital, Port-au-Prince, and at the time, 5 times as many men contracted AIDS as women, and as well, roughly about 10 years later, by the early 90s, that ratio, male to female, was down to it's 1.5 to 1 to 1. So it was 1.5 men to 1 woman who had the disease, and now it's roughly 50-50. Okay, now I'm going to talk about some of the entities that are significant with respect to surveillance of HIV/AIDS in Haiti. And it's important to note that since 2005, HIV Healthcare Services has been tracked through MESI, which is the Monitoring and Evaluation and Surveillance Interface Electronic Database. And although it's currently expanding to collect data on a national level, the initial reporting of HIV service delivery data actually came through PEPFAR-supported sites only. And these sites submit aggregate monthly data to MESI. And I'd like to also mention NASTAD, which is the National Alliance of State and Territorial AIDS Directors. They've worked with the Haiti Ministry of Health since 2003, and their work focuses on a lot of areas that support comprehensive HIV surveillance. And they've helped to develop a national case-based HIV surveillance system. They've done a lot of other things, but this HIV integrated case surveillance system has really focused a lot on HIV and TB. And the result of the system is the generation of case reports that are submitted via a web platform. And it's all built into an existing IT infrastructure, which receives these case reports on a daily basis. And it goes a long way towards tracking the progression of the disease throughout the country, as well as taking action to mitigate the effects. And as recently as the end of the year 2014, over 250,000 case reports had been received from a total of 4 electronic databases, which are shown in this slide. And these case reports actually represent roughly 90% of the annual HIV diagnosis in the country. Also, to further support comprehensive HIV surveillance, NASTAD Haiti, as well as the Ministry of Health, co-facilitate a national HIV surveillance working group to guide planning and timing of surveillance activities, as well as the use of generated surveillance data. And it's important to note also that in the wake of the 2010 earthquake, PEPFAR has contributed a significant amount of money towards surveillance. And through this, they've been able to identify a couple important issues, that there are low rates of early linkage to care after HIV diagnosis, as well as large attrition within the overall antiretroviral therapy cohort during recent years. And this attrition has been a really big problem in the country as far as keeping incidence low in Haiti. Also important to note is iSante, which is Haiti's national HIV care and treatment electronic medical record. Now, in the wake of the 2010 earthquake, there's been it's created a lot of difficulties with respect to surveillance in country, and you could see from these charts here around the early part of 2010 how the utilization of the number of particular centers was temporarily decreased significantly. You'll see this spike down. And this is essentially the impact of the disaster. So this really creates problems with surveillance when you have this IT infrastructure that's dedicated towards tracking those who are infected and treatment regimens as well when they're no longer functional because the whole country's essentially collapsed. To give you an idea of the burden that HIV has presented to Haiti, the number of cases is roughly about 150,000 people in country. And the prevalence rate is about 2%, which is significantly lower than it has been, although for the region it's much lower than this, and actually in neighboring Dominican Republic it's about half this prevalence rate. The incidence of new HIV cases has declined significantly in the first decade of this century, from roughly 0.22 down to 0.1. And currently the mortality rate is about 7,500 deaths per year. And it's impossible to gauge the effect on society. Of course there'd be lower life expectancy, higher infant mortality as a result. People lose loved ones. They become economically dependent or unable to provide for themselves. It could increase the number of orphan children, as well as people engaged in illicit activity, whether it's prostitution, drug trafficking, or even human trafficking. And this slide actually gives you a view of how Haiti stands up with regard to its neighbors. As I mentioned previously, Haiti, when compared to the Dominican Republic, roughly about twice the prevalence as its neighboring country. And it's also important to note that the number of deaths per year in the Dominican Republic is less than 2,000, whereas, as mentioned previously, in Haiti, it's about 7,500. Now, this slide gives you a little bit of a glimpse into the demographics of the epidemic in Haiti. With respect to prevalence, it tends to be fairly roughly about the same between urban and rural areas, with the exception of there's a couple cities which are outliers, which have significantly higher prevalence rates, and that would be the city called Carrefour, which is known for sex workers. And also to note that with respect to men and women, women tend to have a higher prevalence at a younger age, and it tends to diminish as women age, and male prevalence tends to increase with age, as you can see here. And also with respect to the number of AIDS deaths per year, there's it's interesting to note that children, there aren't that many. It tends to be about 200 boys and 200 girls per year, whereas with women, they tend to be slightly less deaths per year than men. I have a figure from a few years back where it's roughly about 1,900 women die per year versus 2,200 men. The predominant risk factors today are basically unprotected sex and untreated STIs. Now that this is a generalized epidemic, when it was more concentrated, it tended to be some of the high-risk groups, such as men having sex with men and sex workers. Not as much intravenous drug users, because that's pretty rare in the country of Haiti. There are so many barriers to effective AIDS control in Haiti, but so much of it comes out of disasters, economic and political upheaval, internal migration, people living within the encampments, not having access to care. I mean, it's just a long list. It goes on, as well as gender-related violence and poverty, and, as I said, political instability. Among the other barriers are the stigma associated with having HIV, people not seeking care as a result, as well as the number of facilities. Roughly about 60% of health facilities were destroyed in the earthquake, as well as 10% of the medical staff were actually killed. So with roughly 10% of the population of the country living in encampments for a time, it's no wonder that a large percentage of people did not have access to antiretroviral therapies. Organizations such as Partners in Health have gone a long way towards introducing primary care in rural communities, especially with respect to virtually eliminating mother-to-child transmission of HIV. Meanwhile, Gesgio has also been indispensable in the fight against AIDS. Equitable access to care and